So, good morning, good afternoon, and good evening to the Pasteur Network community. Welcome to this new Pasteur Network
Pardon,
seminar.
filtre-moi ça. Donne-moi le nombre de gens qui vont être à Niamey, s'il te plaît.
I will have to
mute everyone.
Mute. I will try to mute everyone, but I can't do it. But I will ask everyone to do that. Okay, so as always, we're going to kick things off with other speakers, followed by a Q&A session. Feel free to drop your question in the chat or ask them during the Q&A. Please don't forget to keep your microphone and your camera off, and so to have to help us have the seminar run smoothly. The seminar is recorded and will be shared soon with all the community on our YouTube channel, the Pasteur Network YouTube channel. Today's topic is mapping modeling in the Pasteur Network capacities, challenges, and future perspective. And for this seminar, we have our two speakers. First, Slimane Benmileh. Slimane is biomathematician, actually serving as a professor at the Laboratory of Bioinformatics, Biomathematics, and Biostatistics, responsible of the group Modelization and Public Health at the Institut Pasteur Tunis. He was also the head of this laboratory between 2020 and 2024. His research primarily focuses on mathematical modeling in epidemiology and population dynamics, emphasizing public health. As a university professor, he has also advanced biomathematics in Tunisia by organizing summer schools for biologists and establishing master program in information processing on the complexity of life at the University Tunis El Manar. He has led numerous projects, including repair, analyzing COVID-19 in Africa, and participated also to crisis committees for Tunisia's Ministry of Health during the COVID-19 pandemic. Slimane is also member of the Council of the Complex Dynamical System Unit WIN, UNESCO, and serves on the Ovid Arino Prize Awarding Committee. Our second speaker is Claude Flamand. Claude is an epidemiologist and head of the Epidemiology and Public Health Unit at the at the Institut Pasteur in Cambodia. He earned a Master in Biomathematics Biostatistics at Paris 5 University and a PhD in Epidemiology and Public Health at Université Paris-Saclay, focusing on dengue outbreaks in French Guiana. He began his career with the French Field Epidemiology Training Program between 2005 and 2007 and spent 9 years at the French Public Health Agency leading the French Guiana Epidemiology Unit between 2007 and 2013. He joined the Pasteur Network in 2013, heading the epidemiology units at the Institut Pasteur in French Guiana, before moving to Cambodia in 2022. His research focuses on the transmission dynamics and of priority pathogens, including arboviruses and zoonoses, using a multidisciplinary approach combining epidemiology, biostatistic modeling, and public health policy. Okay, before heading over our two speakers, I would like to do two things. The first one is to encourage everyone here to register on our platform. So it's called Hive, which will be used by the Pasteur Network as knowledge sharing platform. This platform, it will be open to everyone on the Pasteur Network and not only scientists. When I mean everyone, I really mean everyone. And we will be soon organizing our monthly seminar directly on this platform. It allows everyone to have access to exclusive content about the Pasteur Network and its member. And I will copy the link to register on the Hive on the chat in a few minutes. Second thing, I will give the floor, before giving the floor to our speakers, give the floor to Annabella Fayou, who is a medical entomologist at the Institut Pasteur in Paris and president of the COSPN, Conseil d'orientation scientifique from the Pasteur Network, under which this study will be presented in a few minutes by Slimane and Claude, was established. Annabella is also the president of the recently created Pasteur Network Scientific Working Group. She will give us an overview of what has been achieved so far and present the next step of these working groups. So Annabella, the floor is yours.
Thank you very much, Slimane. So my name is Annabella Fayou. I'm from Pasteur Paris and working mainly on medical entomology. So the COSPN, if you don't know, is the fruit of the reflection of the different directors. It was in 2016, And they had decided to build a kind of community around the different strategy in terms of projects that can put people together and sharing the knowledge. And this was adopted in Ivory Coast. It was in 2017. And then you have a kind of report written by Kusai Delaji, you may know. And this kind of document advised to the Pasteur Network to have this kind of committee. So the committee was composed at the beginning of 6 members, evolved into something like 12 members, and covering most of the regions and different disciplines. And these members have been designed by the directors and the different from each institute, and the objective is to cover the 4 main axes of the in terms of research. The first axis is on the zoonosis, the second one on vector-borne diseases, the third is on the mother-child health issues, and the fourth one is on the aging and neurodegenerative diseases. And among the mission of the COSPIAN is to build up some working group to make the inventory.
Annabella, you're muted. We can't hear you.
You can't hear me?
Yeah.
Okay.
No, that's fine. That's fine. It was just for 2 seconds. Go ahead. Sorry.
Okay. So among the mission of the COSPIAN is to build up some different working groups, and up to now we have set up 7 working groups, and the first one was on vector-borne diseases, which is in the heart of my discipline, and it was completed in 2022. The second on the child health completed in 2022. Another one on emergence completed in 2024. The fourth is on the wildlife, completed in 2024. Another one on microbiota and antimicrobial resistance. And the number 6 is on the neurodegenerative diseases and psychiatric disorders. And the last one is this one on modeling and mathematical modeling epidemiology. And we have produced different reports which are available on the Hive platform. That's true. you can download them on the platform. So please go in the platform, register in the platform. You have all the information you can get from all this work we did on the different topics. I think that we did. It was a huge amount of work. I hope that you can try to get information from these documents, and do not hesitate to download all them, because you can have a kind of snapshot on what we are doing in the Pasteur Network in terms of the different topics. So now with the changes on governance in the Pasteur Network, the COSPIAN we've evolved into a scientific working group. And so you have received all of the institute different announcement that different call for getting members on different working groups. You have 9 working groups. The first is on mother-child health, vector-borne diseases, antimicrobial resistance, on vaccine, therapeutics, diagnostic, science equity, epidemic preparedness, and the last one is ethics. Please, I think that you are aware that it's very important for us to have the people for all institutes in these working groups, and the application is now closed, and the candidates will be notified soon in which working group they are. Renaud, who is in charge of that, has already have 100 people who have applied. We will have around 10 people per working group. You will have more details in the coming weeks. I think that this is very important for the Pasteur Network to put all the people together and to share the same information and to discuss between us. So I think that's all for me, and I'm very happy to to introduce the two professors, are very key person in mathematical modeling. I hope you will enjoy their survey. Thank you.
Thanks a lot, Annabella. Thank you very much. It was important to give the whole context and also the new strategy of the Pasteur Network for the new scientific strategy with the better contribution of its member and the Pasteur Network member. Okay, so I will give the floor to our two speakers. We will begin with Slimane. Slimane, the floor is yours. You can share your screen.
It's okay. Hi, everyone.
Yes, we can see it. Thank you very much.
Okay, great. Thank you very much. So hello, everyone. I'm very happy to present you we are very happy to present you the survey that we've done and on mathematical modeling in Pasteur Network. And I hope you're going to have a rich discussion after that on the position of mathematical modeling in the Pasteur Network and how to improve it and how to go further. So mainly the presentation will be divided in three main parts. The first one, I will give you a small presentation on what is mathematical modeling and putting in historical context. The second one, I will present a survey that we've done and to see what is the gap, what you already have in the Pasteur Network and what is the gap that you have. And finally, we will present you the main gaps that we have and how to go further on the modeling in Pasteur Network. And we will do it with two comparative examples. The first one is between Pasteur Institute Tunis and Pasteur Institute Dakar. And the second one is going to be between Pasteur Institute of Cambodia with Pasteur Institute of New Caledonia. So let's begin. What is modeling? In fact, modeling in epidemiology is a formal approach. What I say formal, it means in really formal means formula. It's a formal approach. It's mathematical and stochastic, used to describe, analyze, and predict the spread of the disease within a population. So it simulates social interaction, pathogen characteristic, population behavior, and the impact, and then we can study the impact on public health intervention. So it's very important what I am saying because in fact the modeling is similarly like in physics. The goal is to find the disease law, equation, or force representing the dynamics. So it should not be considered as a tool, but it should be considered as a new approach of seeing things. So the well-known model is what we know, I think all of you know, is the SIR model for SIS for susceptible, I for infected, and R for resistance. So if you try to compare what is modeling between bioinformatics or statistics, so bioinformatics mainly focus on molecules, where modeling focus on individuals. And statistics analyze the information from the data, while modeling study the process. And mainly modeling try to understand what is the process underlying phenomena. If you are a disease, our goal is to try to understand how the disease can be spread in the population, what is the force acting on it. So if you go a little bit from, it's not a new, it's really not a new science. It goes from Hudson and Ross. I think all of you know Ronald Ross. Ronald Ross was a Nobel Prize in physiology. And Hudson, Ross, Mackendix, and Kermack, they are 4 persons who made the created the SRR model, and they had this idea what is behind. So I just note that Mackendix was director of Pasteur Institute in Punjab. But it means that modeling was inside Pasteur Network for a long, long time. It was one of the pioneers of the mathematical modeling in epidemiology, was a director of Pasteur Institute. So it goes from early 20s, let's say. So if you go and I calculate the number of publication here. You have the number of publication with the keyword. With public health or COVID versus public health, COVID and modeling. from 1970 to 1920, you see that you have an exponential increasing. This is the ratio between the two, the number of paper. If you observe that this because, in fact, because epidemiological modeling meet ecology from the 90s, let's say the middle of the 20th centuries. You have an increased number of paper of point of view of modeling in ecology. And as epidemiology is a part of the ecology, epidemiology should try to understand the interaction between human with the disease, but also between human vector and the disease. And it meets the dynamics of the ecology with where the dynamic ecology is mainly mathematical dynamics, mainly mathematical vocabulary, and you have a lot of work there. So this synergy between ecology and epidemiology make that the mathematical modelings take more and more place in the area of epidemiology. So what is the main objective of our survey? The main objective of our survey is to access an existing modeling capacity within Pasteur Network. This analysis aims to identify strengths and specific needs related to modeling across different institutes. To promote strength use of modeling within Pasteur Network. So the survey, the methodology, in fact, the survey was sent to the 30 Pasteur Institutes across Pasteur Network between May and September, and we received 16 responses from the following institutes. And you have AP Guinea, Korea, Cinciano, New Caledonia, Algeria, Tunisia, Montevideo, Madagascar. Cinciano is written twice. Cambodia, Fondation Oswald de Cruz, Dakar, Cameroon, Bangui, and Selmes. Additionally, we received the response of Institut Pasteur of Korea, which was we received later. We have contacted certain groups, specifically the one of Madagascar and Algeria, to clarify their response and gather more detailed information. So key observation, in fact, the Guinea and Laos currently have no interest in promoting modeling. And New Caledonia conducted have some work on modeling, but the activity was done with ERD. They have a very strong relation between New Caledonia and ERD. And in Korea, they only are involved in drug discovery. So the type of groups that exist in the Pasteur Network have different names. And it's very important, this idea, because it gives you what they are doing and how the philosophy on modeling. For example, in Brazil, in Fiocruz, the name of the group is Analytic Method for Epidemic and Surveillance Groups. It means that they are mainly working on analytic method for epidemiology. In Tunisia, you have three elements: is bioinformatics, biomathematics, and biostatistics. It means that we group bioinformatics, biomathematics, and statistics. I mean, you made a lab on engineering topics to biology or to public health. In Montevideo, is only bioinformatics. In Dakar, is data science and modeling. And it depends on a huge department whose name is epidemiology and data science. Cambodia is data and methodology group, and it belongs to an epidemiological unit. Since they say that they have no groups, Cameroon is a data science and modeling, and also it depends on epidemiology and public health. Algeria is a lab of modeling and biostatistics. Madagascar is biostatistics and modeling, and in Bangui is data science and modeling. So if you go for the number of human resources, we observe that you have 41 faculties working on modeling, directly working on modeling, and with 19 PhD students. And so the bigger one is Tunis, Fiocruz, and Dakar, and Montevideo. The three top in the number of faculties. And with a small remark. The first remark is Pasteur Institute. We have a significant proportion of bioinformatics inside the lab. Montevideo has dedicated focus on bioinformatics and statistics. And IP Cambridge has strong collaboration with the unit of Paris. They has strong collaboration with Paris. This is what we observe. Then if you go further, you can classify the groups into three main groups. The first one, what I call good capacities. It means you have more than 4 researchers in the lab and with a PhD student. So in these groups, you can find IP Dakar, Tunis, and Fondation Osvaldo Cruz. Then what we call the second groups, which is with a mean capacity. And you can find Cambridge, Algeria, Hazard, and Cameroon. The third one is a low capacity. What I mean low capacity is 1 person or no person. So we can find here the CELMES, Institut Pasteur New Caledonia, IP Madagascar, or Bangui. So you need to know, for example, in CELMES and in Madagascar, they have only 1 student. For example, CELMES, they have 1 student in modeling who is formed in Tunisia. And in Madagascar, they have 1 PhD student who is formed in IP Paris, in Paris. For example, in Bangui, they collaborate, has strong collaboration with Cameroon, and they work together. There is only 1 senior professor in Bangui, and they have strong collaboration with Cameroon. So if you go further and you try to understand, we had a question to see how they interact with public health authorities. And we observe that we have a very strong interaction with public health structure. And mainly 70% of the Pasteur Network who answered to the questionnaire say that we have a collaboration with public health authorities, and mainly in the outbreak simulation, COVID-19 data collection committee, surveillance committee, and scenario analysis committee. So if you then, we evaluate more or less how the resource, in terms of computer resource, they have a good.
You please, turn off your microphone, please. Thanks a lot.
So in terms of the resource, they have a very good resource, strategic computer resource. In terms of and also you have very opening. All the group are open to all the, I'd say, the university and the environment. He said what is very important is the data source. And then you see that we have mainly 3 levels. You have the one that they use their own data set, which is IP Dakar and Cambodia. And the one who use the data set that are inside the institute, mainly Cameroon and Bangui, and the one who use external data set, and mainly is Fiacruz and Alger. And this gives you an idea how the group interact with the community inside Pasteur, and how the group is integrated in a bigger group, which is the epidemiological group. Let's go faster. So if you look at the analysis by modeling approach, in fact, we subdivide the modeling approach in different subscale, and to see how the capacity to use all the techniques that are used. We observe that statistical techniques as well represented within a network, and very well, which is quite normal. Then if you go more in other type of modeling, which is what I call the differentiable equation modeling, which for example, the SIR models are in these groups, we observe that this quite well represented, but less than statistics. And if you go further, if you look at what we call the age structure modeling, is the age structure modeling can integrate the dynamics of the population dynamics with age. I mean, mainly the demography, how the demography can integrate in the model in order to make prediction in the long term. You see that it is really less integrating in the network, And the last one is stochastic model, is very weakly represented. Stochastic model is taking into account the probability to have something to happen. Then we go to analyze the computer modeling. If you go to the computer modeling, you have supervised and supervised learning, and GIS are well represented. However, the multi-agent model, which is the logical continuation, the GIS, is really less represented. And finally, the natural language processing is very underrepresented. Natural language processing is like ChatGPT or whatever, all these other type of tools that is and computer analysis, computer language modeling. Now, if you go to see what's happening inside the institute, you observe that, as I said, statistical is represented in all the Pasteur Institute. The computer model is represented mainly in Cambodia, in Sanciano, Dakar, Fiacruz, Cameroon, Tunis, Madagascar, and Montevideo. And the compartment models is not represented in Montevideo and Madagascar. However, is represented in all the other institutes. Multi-agent models is, I think, is represented only in Tunis, for example. Now, I put it here. When you have 100%, the institute are the capacity to understand all type of model that is represented in the computer modeling, and you have this in all the set. As you see, the graph analysis modeling is not represented at all in the network. The best, the one that is well represented is all techniques that are related to statistical analysis. With computer-based modeling the agent. Now, if you go to see what type of research we are doing, in fact, you observe that mainly what the research that's well represented is epidemiology, disease transmission, health policy, and vaccination, which is classical area where modeling can be applied. We also have climate change and vector ecology are well represented, but not ecology, which is quite interesting because they are interesting only on the aspect of the epidemiology and climate change on epidemiology, but not on the ecology of the vector. The one that is not very few or unexisting representant is antibio resistance and microbiota, which is almost no existence in the network. Then you see how we are open to the environment. As I said, you have a strong correlation with the university, high participation in international project, and with one exception, which is the Fiacruz. Fiacruz is almost founded by Brazilian authority and agency. It means that also that the Brazilian government give a lot of fund to modeling, let's say to research and also to modeling. I put it here how each institute can the impact of each one of collaboration, teaching activity, research activity, and funding by Pasteur. We observe that Dakar have begin to have, for example, begin to think how quality management can be addressed in the structure. And as I said, almost all the institutes are involved in teaching and collaboration, opening to the environment and research activities. Now let's see in more detail what we have in type of research that we are doing. In fact, we observe that vector ecology is almost present in all the institutes. Also, the disease epidemiology risk factor are also very present. Transmission dynamics are, the study of transmission dynamics are present. What is not present is social science, determinant, and behavior. Is almost no presence. We have also very few representative research in immune response dynamics, which is we can have a good modeling in immune response dynamics. So what I said here, however, some area remain underrepresented, which is immune response, social science determinant, and behavior. And perhaps we need to try to think how to involve this type of, how to help to the development of this type of things. So the suggested gap. In fact, we asked a question on what each one think that what the gap that they have. The first one appeared at the health economics and medical technology assessment. And the second one appeared at geospatial modeling, with two main areas, with using climate and environment data and Asian-based modeling. And then arrived AI and machine learning, age physiology and structure, which, as I said, it's more about integrating demography inside the models. And we had a lot of ask about training statistic training, and everything. So I will stop here and give the hand to Claude, who will present you the third part of the presentation, which is comparative and analyzing better the gap that we have.
Yes, thank you, Slimane. So the idea of the second part is to have a more detailed description of the capacities of some institutes, giving some example of the different situations that we have, and also provide some, highlights some barriers, but also some recommendation in order to increase the capacities of the different institutes in the Pasteur Network. So, as Slimane mentioned before, for this moment, we received 16 responses from the different institutes who were contacted, but we will continue the efforts to include additional institutes, notably the mathematical modeling unit of IP Paris and other institutions that we know personally to continue to increase before final and global analysis. But we have already a big part of the institutes that we were expecting to reach, but we will continue the effort. So key findings show significant variability in capacity. So some institutes have well-established modeling labs, as we see, with multiple researchers, several postdocs and PhD students. Others have limited capacity, often driven by a single researcher or external collaboration to help to analyze the data, identify research questions, and a few institutes have no specific modeling capacities, which can impact the ability to identify key research questions, conduct high-impact research, and foster international and intra-network collaboration. Yes, you can switch change the slide. Change slide. Slimane, you can change? Yes. Okay. So I cannot see this. Okay, so we identified several types of structure across the network. So we have institute with dedicated modeling and epidemiology unit. So most of them, as in the epidemiology unit, they conduct the modeling activities. We have, for example, IP Tunis, IP Dakar, and Fiocruz with well-established and long-term teams working on this topic. We have institutes integrating modeling within epidemiology units. Often through collaboration within the Pasteur Network, but also external partners. It's the case of IP Cambodia, for example, IP Montevideo, which integrate in a bioinformatics unit. We have institutes with limited capacity, where modeling relies on one or two researchers and external supports, like Institut Pasteur of Madagascar, Institut Pasteur of Bangui, and there are institutes lacking internal capacity that are fully dependent on internal expertise. So these disparities directly impact the ability of institutes to develop the different projects and to secure funding also, and to influence public health decision-making. And our analysis of research themes shows that some areas are well covered, while other areas are underrepresented. Slimane just mentioned that. So yes, I think, Slimane, we can move to the next slide because we already talked about this part. Okay, so if we can change the slide, Sliman. So in the next stage, we will see different examples. I don't know if you see the change of the slide. Yes, okay, thank you. So yes, so now we will see some examples that to highlight the different capacities that some units has. So in the high capacity group, for example, the bioinformatics, biomathematics, and biostatistics laboratory headed by Sliman was established in 2016 with the mission of integrating engineering science into biological research, covering all scale from molecules to individuals. So it's a team of 20 researchers and PhD students which conduct multidisciplinary approach to foster advanced methodological innovation and ensure strong alignment between research question and applied modeling approach. However, some challenges remain. Despite the capacity of this group and this size, there are limited data access in some specific area that can slow research progress. Modeling could also be perceived, Sliman already mentioned that at the beginning of the presentation, as a simple tools rather than a core scientific disciplines. And cross-laboratory collaborations remain limited, reducing also collaborative and interdisciplinary exchange. So despite these challenges, the lab has successfully secured about 700,000 of competitive funding, including the African Modeling and Analytic Academy for Women and contribution to multiple international projects. And in the last 3 years, the team has published over 25 research papers in leading papers such as BMG Global Health Scientific Report, Infectious Disease Modeling in the scope of modeling and epidemiology also. You can change, Sliman. Yes. Another example is the Institut Pasteur of Dakar, which has demonstrated an important commitment to integrating epidemiology and data science and modeling. So before 2016, there were 2 separate groups. But since then, the Institute has created a dedicated epidemiology data science unit to reinforce its expertise. And there is now a team of 8 researchers and PhD students. And about the case strength, there is an early integration of modeling in research design and the holistic approach that help to formulate research questions and to implement appropriate methodological study design. I hope that you see well, because I don't know why now I cannot see the slide. Okay, so among the challenges, the shifts from fundamental research to applied approaches has led to a greater focus on technical solution and data visualization. Sometimes at the expense of methodological innovations. That was one of the challenges that was reported in the survey. IP Dakar has been highly successful in secure funding also, including the AMAX program also that was coordinating the PI was Institut Pasteur of Tunis, but Institut Pasteur of Dakar was also included in this project and over One Health initiative. Yes, also contribute to significant publication in modeling and also epidemiology journal. Okay, we can move. So another example in the second group is talking about the Medium Capacity Institute. So it's we'll talk about the Institut Pasteur of Cambodia, so and the epidemiology unit that I had for 3 years now. So there is one methodology and data analysis group in this institute, which include about 8 scientists. And the idea is to, I mean, this is an example of epidemiology units which combine field epidemiology, community epidemiology, collecting data on the field, and having some data analysis parts that include some modeling approach and So I have a long-standing collaboration with the.
Could you please turn off your mic? I will do it. Merci. Go ahead, Claude.
Okay.
Thanks.
Yes. So we are not a modeling unit, a modeling group, such as, for example, in Tunis and Dakar, but we have a long-standing collaboration with the mathematical modeling unit at Institut Pasteur of Paris in the Pasteur Network. And this collaboration was initiated a few years ago when I was in Institut Pasteur of French Guiana. And it's a formal affiliation to this unit that help to conduct a strong collaborative project. So about the key strands, there is a win-win. This is a win-win collaboration fostering interdisciplinary research. So contributing field data for the modeling group of Simon and strengthening methodological expertise in the different projects that we have. It's also helped to enhance research visibility and improve data analysis capacities and secured significant funding. So in the recent year, with this kind of collaborative project, we were able to secure about $7 million of funding. So it's helped also to have different capacity building with co-supervision of students, scientific visiting, and participating to weekly staff in order to identify the specific research questions that could be added to specific projects. And we had about 8 papers in epidemiology, but also modeling journals that is related to this kind of collaboration. Okay, we can move Slimane to the next slide. And we will now move to the last group, the third group, yes, which is the Limited Capacity Institute. And so this is not extensive. I just put some example of the different groups to show what are the capacities, how it's organized also. So in the third group, we take the example of Institut Pasteur of New Caledonia. Currently, Institut Pasteur of Caledonia lacks of a dedicated epidemiology unit or a dedicated staff, scientists, relying instead on partnership with several teams, like, for example, the team of mathematical modeling unit of Paris, of external collaboration with the IRD, Nouméa, which is a team, modeling team based in New Caledonia, in Nouméa. But they find they have a co-supervision for a PhD, co-supervised by IRD and also by the arbovirus unit of Institut Pasteur of New Caledonia, which is now a postdoc in the modeling unit of Paris, with perspective of potential reintegration after the postdoc or after several postdocs. So despite limited internal expertise, Institut Pasteur of New Caledonia has initiated a strategic collaboration to contribute to public health strategies and response to health crises such as COVID-19, and has played an important role in some large-scale projects conducted in the area of the Rollback project. So, however, persists for sure with the lack of resources to sustain epidemiology and modeling efforts, with a strong dependence on external expertise. So it could be in the Pasteur Network sometimes, but quite often it's associated to an external partnership, which limits sometimes the research autonomy of the team, and there is no dedicated funding for epidemiology or modeling project during the recent years. Yes, there have also 5 publications in collaboration with IRD as example of this kind of adjustment and partnership to strengthen the capacity. You can move yes, to the next one. Yes, so across the Pasteur Network, we have identified several barriers to strengthening epidemiology and modeling. So no, I think it's
Slimane, it's the slide before.
yes, the slide before, Slimane.
Yeah.
Yes, thank you. So the first one is the lack of dedicated personnel and structured units, limiting in-house expertise and slowing research progress. There is also high researcher turnover in the different institutes of the Pasteur Network and lack sometimes of transition strategies, disrupting long-term projects and preventing knowledge retention. And it's the case in some institutes, for example, where the dedicated researcher move, and after several months or sometimes several years, there is no new researcher to continue to maintain this capacity in the institute. There are also challenges in data access and integration, making collaboration and large-scale study difficult sometimes. There is also limited training programs in modeling, epidemiology, reducing some opportunities for skill development and independent research. And weak intra-network collaboration. I think there is still a great deal that remains to be done to strengthen the collaboration within the Pasteur Network, probably at regional level, to facilitate the research progress, the identification of regional question research, and topics that are shared by different institutes in order to build and to take advantage of the Pasteur Network. So to overcome this challenge, we could propose a series of strategic actions. First is to ensure at least one dedicated epidemiologist or data scientist per institute to establish a foundation for in-house expertise, because like we could see, even if there are very big dedicated team for modeling units, most of the time when you have only one epidemiologist or one data scientist, it could start the process to initiate collaboration, to facilitate the attractivity of some students, having some PhD students, for example, and starting a new process. And after some years, the team can grow, but we need to start with at least one dedicated personnel for that. Another strategic action could be to develop regional hubs for training and knowledge sharing, enabling stronger capacity building at regional scale. Encourage intra-network collaboration by connecting well-established modeling groups who have great expertise and high-level scientific skills in order to increase the visibility, to promote big and ambitious research within the Pasteur Network, and to contribute with less experienced teams in this kind of project. So strengthen institutional support for data scientists and epidemiology units, improve integration with national health strategies also. That could we have seen some example in the survey to show how the health crisis sometimes and can increase the demand of national health authorities for the different institutions, and this is sometimes nice opportunity to facilitate the position of the institute in this kind of area. And finally, modeling. So to conclude, modeling is a rapidly growing discipline with increasing demand from institute and partners, especially in light of recent health crisis. To meet this demand, we must strengthen again the capacity by recruiting dedicated experts in the different institutes who don't have capacities, and fostering intra-network collaboration to bridge gaps and develop expertise. A key asset is the contribution of the modeling unit of IP Paris, who supports several institutes like Institut Pasteur of Cambodia, Institut Pasteur of French Guiana, Dakar, Madagascar, and others. And other high and middle capacity institutes like Institut Pasteur of Tunis, Dakar, Fukush could also further expand collaboration and training initiative at regional scale and international scale, strengthening the expertise within the Pasteur Network. So the impact of this effort could be significant by improving outbreak response, disease surveillance, and public health decision-making, increasing research and funding opportunities, and reducing dependence on external expertise, ensuring that modeling capacities is built within the Pasteur Network itself. So I think this is my last slide. So yes. So thank you for your attention, and if you have some questions or some comments, we will be happy to discuss about that.